Hello everyone, my name is Natalie Ferriozzi. Today I will be presenting my oral abstract for my research on the incidence of disordered eating behaviors and depression coexisting in type 1 diabetics. This is for class Nutrition 5600 at Eastern Illinois University, and I hope you enjoy. We are going to start off with a quick overview of the presentation. First, I will explain a brief background of the topic. Here, I will be discussing terms, definitions, and relevant stats from previous research. This will help us have a clearer understanding of what the research will entail. Next, we will move on to my research question and the purpose of the research. Then we will focus on the methods used to locate the 10 primary articles that will answer my research question. The next slide will cover the results of the findings from the primary studies, as well as address some variances in the articles. And finally, we will talk about the conclusion and discuss how exactly my question was answered. To begin, I will define a few important key terms. Disordered eating behaviors is a broad term or spectrum that includes dieting, binge eating, and a range of compensatory and purging behaviors such as self-induced vomiting, abuse of laxatives, diuretics or diet pills, and compulsive exercise. Whereas an eating disorder is restricted or chaotic food intake, a morbid preoccupation with food, weight, and shape, and a distorted body image. Some common eating disorders are anorexia nervosa, bulimia nervosa, binge eating disorder, other specified eating disorders, and unspecified eating disorders. If we are looking at the disordered eating behavior spectrum, an eating disorder patient would be placed all the way to the right of the spectrum. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. And finally, type 1 diabetes is a chronic autoimmune disorder in which the pancreas produces little to no insulin. Insulin is a hormone that is needed to allow glucose molecules to enter the cells and produce energy. The prevalence of depression in type 1 diabetics is 4 times higher than the general population, where disordered eating behaviors in type 1 diabetics are 2 to 3 times higher than the general population. So much so that a specific eating disorder for type 1 diabetics has been developed in recent years, and that is called insulin omission. So how are these two things connected? Well, mood disorders have been found to be the most common psychiatric comorbidity in eating disorder populations. However, there is limited research on the coexistence of the two in the type 1 diabetic population. For my research question, I will be assessing the incidence of disordered eating behaviors and depression coexisting in type 1 diabetics. My research does include eating disorders because, as previously discussed, those are a part of the disordered eating behavior spectrum. Therefore, the purpose of this research is to assist dietetic professionals in their awareness of the symptoms and occurrences of depression and disordered eating behaviors in type 1 diabetics. I also hope to promote the improvement of screening procedures for these two disorders. Next, we are going to talk about my methods and the steps it took me to find my 10 primary research articles. I used 5 electronic databases through Eastern Illinois University's library. Those were Academic Search Complete, CINAHL, PsycInfo, PubMed, and Google Scholar. The key terms I searched for were combinations of disordered eating behaviors or eating disorders, as well as depression or major depressive disorder, and type 1 diabetes or T1DM. I chose these because I wanted to make sure that the studies I found were related to these key terms and provided timely research or specifically published within the last 10 years. I found a plethora of research on type 1 diabetes and depression or disordered eating behaviors, but not many combining the two. After narrowing down my searches, I screened 30 articles and pulled more resources from those reference lists. Finally, I utilized Prisma, which is an evidence-based set of items for data reporting and systematic reviews and meta-analyses. This method helped me to stay organized, and it can also guide professionals who wish to expand upon this research topic in the future. During and after the time I used Prisma, I specifically scanned 15 articles and narrowed down the final 10 based on my inclusion and exclusion criteria. 100% of my primary articles did show a coexistence of disordered eating behaviors and depression in type 1 diabetics. However, not all were statistically significant. The degree of this can be variable dependent on the p-value, the sample size, and various other things. Correlations and trends were implied. For example, over 50% of the primary studies stated that individuals with moderate to severe depression reported having disordered eating behaviors or vice versa. This just implies that more research is needed on these topics. There were some variances in my research as well. For example, most of them tested with different questionnaires and scales. There were differences in males versus females, differences in type 1 diabetes management styles and success with that, etc. And it is important to note that type 1 diabetes is a complicated chronic illness, and in addition to many other reasons, causation is not able to be declared, but coexistence may be. In conclusion, the research does suggest that disordered eating behaviors and depression can and do coexist in type 1 diabetic individuals. However, more consistent research is needed, and this is because of the variances that were briefly described in the previous slide. Those will be expanded upon in the presentation in 2 weeks. In addition to discussing in more detail article quality, inclusion, exclusion criteria, outliers, specific findings and trends pertaining to the research question, and strengths and limitations to the overall research. Here is my reference slide, and I look forward to presenting my research to you all in 2 weeks.